Okay, welcome to this online presentation about the STARS project. So let me first introduce myself. My name is Ine Vandewauw. I work at the University of Maastricht and I am the coordinator of the STARS project, which is all about empowering patients by professional stress avoidance and recovery services. So let me guide you a little bit through the presentation. So I will shortly explain to you what pre-commercial procurement is, and then I will talk to you a little bit about our STARS mission and the consortium and give you some background on the project, explain the needs and the direct benefits, and then at the end, the partners of our consortium, my colleagues, will share their experience as procurers of or buyers within this project. So at the end, we also have some time for questions. If you already have some questions, you can post them in the chat and I will come back to them at the end of the presentation. Okay, so what is pre-commercial procurement, or in short, PCP? So in fact, PCP challenges the industry from a demand side to develop innovative solutions for public sector needs. And it enables the public procurers or the buyers of the solutions to compare alternative approaches and filter out the best solution that the market can deliver to address this public need. So it does not cover the large-scale commercialization of the product. So it is really focused on research and development. The commercialization is part of the PPI, or public procurement or of innovation, which is a different kind of project. So let me guide you a little bit through the PCP process, how it works. So first there is a preparatory phase in which the needs are really defined. There is a state-of-the-art analysis and also the organization of open market consultations. So these open market consultations are there to start a dialogue with the industry, to see where the gap is between the demand and the supply side, and already to increase some awareness in the market. So after these preparations, a call for tender is published and the industry can submit their offers. So after then careful evaluation of these offers, several of the suppliers are selected and they are awarded a contract for phase one. So in phase one, they have to deliver a solution design and demonstrate the feasibility of their concept. So this is just still a paper phase, let's say it like that. So again, at the end of phase one, these solution designs are assessed, and if they are successful, the suppliers get an invitation to tender to proceed to phase two. So then again, the offers are evaluated and some of them are selected to enter into phase two, in which they have to develop a prototype that will be tested under laboratory conditions. So at the end of phase two, when we have the prototype, when these are successful, again, the suppliers will receive an invitation to tender for phase three. And again, after careful evaluation, some of them are selected, and in phase three, you end up with at least 2 suppliers who will then deliver a first set of products that can be used for field testing at the location of each buyer or procurer. So that's a little bit how the PCP process looks like. So then I can tell you a little bit about our mission and our consortium and what we aim to achieve within the STARS project. So we responded to the Horizon 2020 call, which was about e-health innovation and empowering the patient. So the challenge of this call was to empower hospitalized patients, but also outpatients and their family and caregivers to really support a continuum of care across a wide range of services supported by ICT. And the impact, or the expected impact of the call, is to improve the quality, but also the cost effectiveness of the current healthcare systems by challenging the industry to develop solutions that can enhance the ICT skills of patients and also increase their adherence, to increase the role of the patient and also his or her responsibility, and to support the self-management of health. So how will we do that within the STARS consortium? Well, our mission, our STARS mission, which is led by 5 European hospitals, is in fact to challenge the European industry to develop a resilient support tool that can be applied in the field of patients who have to undergo surgery, with the aim of reducing stress during the entire care path. And so we received a budget from the European Commission for this development of this innovative solution, and the total budget is 4.7 million euro, of which most, so 3.26 million, will flow directly towards the industry. So let me introduce you our consortium. So the STARS consortium consists out of 11 partners who all have a different role and different contributions in the project. So at the University of Maastricht in the Netherlands, we have the overall project coordinating role, and the hospital in Maastricht is also the lead buyer within this procurement project. Then we have 4 other hospitals, of which 3 are located in Spain. 2 of them, Parc, Taulí and SAS, are more general hospitals. And then we have also the Children's Hospital San Juan de Déu in Barcelona. And of course, we have 1 hospital that is located in Italy, and they are more specialized in the care for elderly persons. So some of the colleagues working at these hospitals are also in this session, and they will share their experience with this PCP project at the end of the presentation. So as you can see, we also have several other partners, and they have different roles. So they are involved in, for example, the dissemination or communication, or they have expertise in the ethical domain. And we also have some experts in innovation procurement who help us with their expertise to guide the process in a correct way. So let me share you a little bit of, the background of the project. So why did we start the project STARS? So a fundamental concept, in fact, to understand the STARS scope is the patient journey. So when you have to undergo surgery, it's not just this moment of the surgery alone, it's really an entire patient or surgical journey that you have to go through. And here are some key processes within this journey. So it all starts, in fact, already at home, or when the doctor tells you that you have to undergo the surgery. So you have to accept it and prepare for it in several ways. Then, of course, you have the stay in the hospital with the surgery itself. And then after discharge back to home, there is the process of the recovery and the return to normal life. So for the STARS project, it is important that the solution will address each phase of this patient journey. It's not alone focused on the hospital stay, it's really, it should affect the entire patient journey. So if you or your family have ever undergone surgery, you probably know it's quite a stressful experience that you have to undergo. And feeling the stress already starts at the moment that the doctor tells you that you have to undergo the surgery. So patients are nervous about the operation itself. What are the risks? Are there complications? Will everything be okay? Will I have a lot of pain? But also more practical things like which documents should I bring? Where exactly should I be in the hospital? And so on and so on. So these things are already quite stressful for the patient. And then you have the phase where you go to the hospital. So this is the hospital environment is often already perceived as like quite cold, a clinic, unfamiliar environment. And at this moment, when the patients go to the hospital, the stress levels really go up high, and patients are stressed about the surgery. Will everything go well? Will I be in safe hands? And also after the surgery, did it go well? Went everything okay? Is the pain that I'm feeling, is it normal? When can I go home? And so on. So this is quite a stressful phase for the patient. But also when the patient goes home, there are some things that they worry about. Like, can they follow their daily routines? Which medications should they use and how often? When are the next scheduled control visits to the hospital? Should I follow a specific diet? Is the pain that I'm feeling still normal, or how is the healing process going? So still, even after the discharge from the hospital, patients and their caregivers feel a little bit stressed. So here, I want to thank Dr. Muñoz for this nice figure. You can see the stress levels during the entire patient journey. So you can see they're already quite high when the patient is still at home. So when he first hears that he needs to undergo surgery, he's already quite stressed. But you can see that the stress levels really go through the roof as soon as he is in the hospital. So you can see this is an entire red, high stress levels during the hospital stay. Then after surgery, the stress levels go a little bit down, and then after discharge, they drop even further, although the patients are still not yet fully relaxed and they still experience some stress. So as I mentioned before, for the STARS project, it's really important that the solution will affect the entire patient journey. So all these different steps within this journey. So you can imagine that all these stress experienced by patients is not only bad for themselves, but it also poses a huge economic burden on the current healthcare systems. So studies have demonstrated that stress leads to a higher mortality after surgery. It increases the complications during the hospital stay. It leads to more rehospitalizations. And moreover, also a higher consumption of drugs is necessary to keep these stressed patients sedated during the operations. And this, on its turn, has different side effects such as, or more harmful side effects such as delirium. So studies have also shown that also the wound healing suffers from stress, and that there is a delay in the return to the daily routine and overall a reduced quality of life for the patients and their caregivers. So what are then the needs and the direct benefits of the STARS solution? So in our preparatory phase of the PCP, we really defined several functional requirements that the STARS solution should comply with. And we believe if the STARS solution complies with those, we can empower the patient by stress reduction. So a first functional requirement is the need for information and education. So we expect that the solution can provide information to the patient and their caregivers about each phase of the patient journey and what is expected from them, and also provide personalized, reassuring information, for example, about the operation itself, about the perioperative symptoms, about the pain management, and of course also about the recovery process. So this is one aspect. We also believe that there is the need for follow-up and monitoring. So the solution should allow self-assessment of the perceived stress and also the pain, and then provide reassuring feedback and guidance to the patients. So this information should then also be transmitted to the clinical team so that they can intervene whenever it's necessary. So if they see that the patient is experiencing extreme stress or pain, that they can intervene and guide the patient. Then we also believe that it's very important that there is a good communication. So the STARS solution should also enable effective communication between patients, caregivers, and healthcare professionals, again, during the entire care path. And finally, there is the need for enabling autonomy. So the STARS solution should, in fact, provide the opportunity to create a more friendly and a personalized environment for the patient within the hospital facilities. We think it's important because the hospital itself is often perceived as cold and unfamiliar. So creating a friendly environment would also already reduce the stress. So if the STAR solution complies with all the functional requirements that we set out, it should have some direct benefits for the patient themselves, but also for the STARS group of procurers and hospitals. So it, in fact, should reduce the pre and post-operative complications which are caused by stress. So you can think of high blood pressure, arrhythmias, this delirium, infections, and so on. It should also reduce the drug consumption and medications during the complete patient journey. So you can think of pain medication, sedatives, or sleeping medication, for example. It should also reduce the time for the patient to return to their daily routines. It should improve the communication between the patients and the healthcare professionals, and of course, improve the overall quality of life of patients and their caregivers. So before I give the word to my colleagues, I would like to show you where we are at now. So we started the project already some years ago, and our call for tender was in fact published in February 2019. So we received about, I think, 21 bids, and 6 of these bids were awarded to enter into phase 1. So phase 1, which is all about the solution design, ended at the end of 2019, and we carefully assessed the different solutions, and the successful ones were indeed invited to submit their offers for phase 2. These were again carefully evaluated, and 4 of them were selected to develop a prototype. So we actually only just finished phase 2. So phase 2 took a little bit longer than expected due to the COVID situation and the lockdowns, which made it impossible for contractors to go to the hospitals and so on. So we had to extend this phase a little bit. But by the end of last year, we had the final demonstration of the prototype, which was tested under laboratory conditions. And now we just published, in fact, the invitation to tender for phase 3. So we're now expecting to receive the offers of the successful contractors for phase 3. So we will evaluate them in the coming months and select at least 2, maybe 3, depending on the budget, contractors to proceed to phase 3. And so we're really looking forward to see how the first set of products will function in the hospital. So we will perform a field testing with them at the location of each of the buyers, so in all the 5 hospitals. So that will be done this year and finished by May next year. So we also look forward to, in the upcoming year, give you some updates and maybe some more details about the solution and, of course, the results of the field testing. And so with that, I would like to give the word First to Dr. Muñoz, who is the head of cardiovascular surgery and the cardiovascular diseases research group at the Reina Sofia Hospital in Córdoba, Spain. So, Dr. Muñoz, the floor is yours.
Okay, thank you very much, Ine, and the other members of STAR, the consortium. For us, for our clinical and research team, has been really interesting to start developing this important project to try to prevent and to treat the stress onset or remaining during the cardiac surgery process. The stress, as we discussed several times, is a very uncomfortable and deleterious circumstance that everyone of us is able to feel very easily in our quotidian life, even for a very small adverse event happening around us. It's very common for us to feel that every day in almost every circumstance that are not so good for us. This is really different, really very different when we are a patient and we feel we are sick and we really feel our life or our health in danger. The situation changes a lot when we are not a normal person, but we are a patient, we are a sick patient, and especially if we are a very serious patient of a serious illness or disease. This is really different, as I said, when we are a patient and we are sick and we feel that really we are in danger. That is very common in hospital, but it's very common for the normal population that don't feel this kind of, don't suffer this kind of situations. Everybody can remember for sure some instance in what we receive a really bad news in any aspect on our life, but especially relate to our health or about the health of our relative or loved people. It's very easy for us to remember those instances in that we feel really bad about those circumstances. We as experienced doctors and the experienced clinical team have felt a lot of times in our professional exercise how patients feel the bad news that we frequently give to them in the external consultation, our ward, and in the general situation with our patients. When we have discovered that an human being has a serious illness that manage his life really, and or need some kind of serious kind of operation or procedure that really put in danger his life. For us, it's very common that, and we can feel very frequently what is the reaction of the patient and relatives about that kind of bad news. That is really evident and important in the process of cardiac surgery that really manage the life of patient and put in risk his health in an immediate way. In that patient have really high level of stress from the beginning of the process in what we inform them about the clinical situation they have and about what kind of process they need, including information about the risk, the vital risk they have to assume as a patient and that we have to inform and to care as a doctor. The level of stress and its consequences remain present during all the long process of the cardiac and vascular illnesses, including the knowing of the illness and the need of process to treat it and to try not only to save life, but also to increase the quality of life that they have and they will have in the near future. The waiting list also is very important. The level of stress is very high in the patient and people waiting for a procedure and waiting for that will happen in the near future in the hospital and during and after the procedure. That happen usually at home, and this is very hard for people to wait news about how, about when, and about who has to treat us or to operate on us for a very serious kind of procedure. The previous day for the procedure and the procedure itself, including operating room, ICU stay, and postoperative period at the hospital, also are crucial for patient and for the level of stress, and also all the need period to recover the previous situation to the illness onset. Those stress levels are not only uncomfortable and inhuman for patient, but also can be crucial for the result, as Ine said, of the procedure and for the real risk of complication and death in case of serious illnesses and high-risk procedure. Is that why we are really decided to contribute as much as possible to decrease these adverse events in our patient as much as possible, not only by the STAR project, that also this project serves us to be more conscious, if possible, about the suffering of our patient and the relative by the stress, and also by ourselves, that also suffer a lot of a high level of stress during our professional exercise. We consider the STAR project an excellent opportunity to add our ethical commitment and medical knowledge and skills to high biomedical research level and other exciting aspects such as cutting-edge technology, virtual reality, real developing of technology, and general management of a complex and expensive project of high responsibility for all of us, because the funds are public funds from the European community, and we have to be able to be care about how we expend those funds. That's our commitment, and we are satisfied, very satisfied, to assume it for the good of our patient and the whole society. We are really very excited to contribute to this project and to add and to help our patient and all the consortium in order to try to help our society in that. Thank you very much again for this opportunity and for all the consortium by their collaboration. Thank you very much.
Thank you very much for sharing that with us. Then I would like to give the word to Lorena Rossi, who works at INRCA in Italy. She has prepared some slides. So Lorena, go ahead.
Thanks very much, Ine. Good morning to everyone. As Ine said, my name is Lorena Rossi and I'm a project manager and I represent INRCA. INRCA is an Italian research hospital. Our mission is to perform translational research on aging from biomedical aspect to clinical investigation and social implications. In our hospital, the age of the patient that undergo surgery is really high. About 45 of them are over 75 years old, and we had in the past people that was over 100 years old. Obviously, aging increases vulnerability of the patient, and the surgical stress is a really relevant aspect. One of the greatest fear of our patients is the moment of anesthesia. They fear the side effects and risk associated with this procedure, mostly because they are people who already suffer from other important diseases like diabetes or cardiovascular or respiratory disease. So, to lower the risk related to surgical process, our staff use a holistic approach. From the technical point of view, our professional has developed an innovative technique for continuous subarachnoid anesthesia that avoid most of the complication and the toxicity of the general anesthesia. But in the same time, there is a really special care to the factor that can influence the well-being of the older patients. Just for example, before the surgery, the patient has the possibility to meet the team, especially the nurses that will meet in the operating room. this created some kind of empathy between the staff and the patient and decrease the fear and the stress. The staff pay particular attention to establish a relationship with the patient. And we have experienced that, for example, these measures contribute to maintain under control the number of cases of post-operatory delirium that for elderly is really an important problem. In normal condition, actually, obviously during COVID is impossible. The caregiver, for example, has the possibility to stay with the patient till the moment that they physically enter in the operatory area. So for us, STAR project is really an important opportunity to increase our care of our patients, because we already have a lot of care of our patients, but we need to extend this possibility, because obviously the attention that the staff can give to the patient is limited to the moment when there is a relationship between the patient and the staff. For example, the moment where the decision on surgery are taken, or when there is the admission, the preoperative phase. But there are a lot of moments when anyway the patient is alone with these fears, especially when it's at home, before and after the stay in hospital. So an SOT solution can cover this gap, creating a continuum for all the time of the process, from the start to the end of the recovery period. Another issue that it's really important for us, and that we have tried to give as an input to the consortium, that we are searching a solution that is authentically inclusive, that had a really inclusive approach in the design, in the SAT procedure, that considered the need of all the different category of people that undergo surgery, because in our hospital we take care every day of very old, but elderly people is anyway in general the most represented category in hospital patient, and the solution that fulfill their needs is a key issue for the future success and the commercialization of the product. And therefore it make the solution really usable, even for the elderly. Using the paradigm, for example, of universal design, it's something that will be rewarded in the future for the producer of the solution itself. We consider PCP really an interesting approach, because it gives the opportunity to build the solution with the contractor. Obviously, there are other ways to work with the product designer, like, for example, in a research and development project. But in PCP, the added value is the possibility to evaluate and follow the development of different solutions, and to understand the best of everyone. And the PCP gives somehow the possibility to share the risk, because usually you already are in a standard procurement, you receive something that is already done. But on the contrary, following the development, the procurer have a clear idea of what the final product will be, even before that the product is finished. And on the other hand, the suppliers know what really the potential client wants. And obviously, in a project like STARS, because PCP is a general approach, is really important and relevant, the collaboration between the procurer in the definition of the requirement, because putting together the different needs of different kind of organization, we were able to create some requirements that are somehow a guarantee that the solution will fit the needs of different kind of clients, and it is important even for the enterprise that participate to the PCP. And the most interesting things from my point of view is that while in a standard procurement, the focus is on the technical requirement, the technical specification of the solution that you want to buy. On the contrary, in the PCP, the focus is really on the needs, and this leave the floor to the supplier, because they have a lot of great degrees of freedom in creating the product, and can explore solutions that are maybe completely different which were the expectation, the initial expectation of the buyer. And this can really increase the possibility to have something that is really innovative, because we are open to accept the different solution, and this is the real force, in my opinion, of the PCP. Okay, and for me, it's all. Thanks again.
Thanks very much, Lorena. I agree with you completely, and then I finally would like to give the word to Andrea, who works at the anesthesiology department of Parc Taulí. So Andrea, please go ahead.
Thank you very much, Ine, for your presentation. I want to share my experience from a different point of view. We had a surgeon, we had an engineer, and now we have an anesthetist. I think it's good, the 3 points of view, very different. I'm very grateful to participate in this PCP. I think that in the past, the clinicians, we didn't look about the stress, about the patient's feeling. The patient was a passive subject. We only were worried about the illnesses. And now we are really focused on these feelings, on this stress that Ine has showed that has impact and has negative results. And now with this step, with this huge step, we are working in a 360 perspective of the patient. We are not only the body, we are treating also the mind and the feelings. And this is in the same line that works with the fast track surgeries and the rehabilitation in the surgeries that are working in the same line, working in the education, pre-education before surgery for the patient, and giving more information to the patients and to the caregivers, because patients want to have all the information in a time where you can just Google and have access to very different informations, but that are not reliable. They want to have the specific one on their surgery. So I think that we are not only treating the stress, we are doing health education, and we are giving also improving our communication to the patients and to their caregivers. So we are working in getting a solution, but that gives a lot of ways to work, because I think that patients nowadays also want all the information, and clinicians, sometimes we don't have all the time to explain all what the patients want. So this will help us to improve every part of the care path of the own patient. In our hospital, the type of surgery that is chosen is hip and knee replacement. And we have been working in this type of surgery before, because we are doing now the fast track surgery. So I think that this will help us, our patients, to go one step more and to improve everything. What we expect, the clinicians and the people that we are working in the project, I think that we expect that when we are living in a world that the technology is so important and we are always using mobiles, tablets, everything, technology, smart TVs, everything, computers. We want that this technology help us to improve this part of the stress and the pain, and to be a tool for everyone, for clinicians, for patients, and for caregivers. I think that this is the complete of the process and the modernization of the medicine. And why a PCP is useful for that, I think, is because we have what Lorena said, we have really good feedback between the suppliers and the procurers, and this is good to assess them, to get the needs that we express and we want. We also give feedback to them to get a better and to have a better product at the end. And it's also good because we have discussions between us, between all the consortiums, and I think this is very richful because we also have different opinions and have different point of view between, for example, the technical parts and the clinician parts, or the ethical parts, or the legal parts. So that makes a whole experience and very complete with all expertise in all the parts. So I think that also what Lorena said is true, that the companies, the industry has a lot of freedom. They have the needs, they have the requirements that they have to fill, but they also can be innovative, they can be creative. So that's good because we want something original and something very, very new. Thank you very much.
Thank you very much, Andrea, for sharing this with us. So then we come to the end of the presentation. I don't know if there are questions at this point. If not now, we will upload the presentation on our website as well. And you can always contact us if you're interested in this project, or if you have questions. Please contact us through the website or through our email address, which you can also find on the website. So I invite you all to follow us and follow the progress, and we look forward to share some more exciting news and some more details about the solutions and the results in the upcoming years.